action.
Oh, hi.
Hello, Mrs. Gill. I am Nurse Jenkins. I am here. I'm going to be your nurse for this visit.
Okay.
Dr. Knight will be in with you shortly, but as of now, I just want you to sit in here and relax and take a breather. I just want to let you know this could be a little bit difficult for some patients. I just want you to sit down here, relax. We see a lot of patients that do every single day. Everything will be okay. So just she'll be in shortly.
Thank you.
Hi. Nice to see you again.
You too.
How's everything going? How are you feeling?
I'm really nervous.
Don't be nervous. Everything's gonna be okay. So, unfortunately, you do have renal cell carcinoma cancer.
Oh.
Now, there's nothing to worry about. This type of cancer is very common in your kidney. It is treatable, curable over time. You will have to get surgery to get it removed from your kidney. And you also will have to go through radiation and chemotherapy and all that fun stuff.
Fun stuff. Wait, I have a question. So,
Yes.
if I do go through chemotherapy, would I lose all my hair?
Yes, unfortunately, I get that question a lot. You will end up losing your hair.
Well, I already went wig shopping, so
Good.
I kind of,
patience.
I was getting up for like the worst possible case. So.
That's yes, assumption. So this kind of cancer was discovered with your recent CT scan
Okay.
for other purposes.
All right.
And it did start off as a single tumor, and we caught it, thankfully, from the CT scan. And it was detected after it grew very large. But that's okay, we can still get it out, and we're very lucky it didn't spread to any other major organs.
Yeah, okay, I got tested for it ahead
Yeah,
of time.
consider yourself lucky.
Yeah.
So, do you have any questions? Anything?
Oh yeah. So I did some research,
Uh-huh.
and I saw that there were different types of carcinoma cancer,
Mhm.
and I was wondering what those were because there were a lot, and I don't know.
There are a lot of different types of carcinoma cancers, but the three major kinds are basal cell carcinoma cancer, squamous cell carcinoma cancer, and the one that you have, renal cell carcinoma cancer.
Okay.
Now, basal cell carcinoma cancer is the most common type of carcinoma cancer. It occurs in cells lining the deepest layer of your skin. And if you see any open sores, red patches, pink growths, shiny scars, or bumps around your body,
Okay.
it's likely you have it. And if you see any of these things, you should call a doctor, get it checked, and then get quick treatment for it. And usually those do spread to other parts of the body, but nothing internal. It's usually on the outside. It's treatable. And squamous cancer, cell carcinoma cancer, when people hear squamous, they think of like a skin cancer, and it is a skin cancer. That is one type of it, but it can also be found in other parts of your body, such as like your major organs.
So like the inside of
your
like,
digestive tract, respiratory tract. So squamous cancer, it can be found on the outside with your skin and on the inside.
Okay.
And both of those usually come from sun, people who lay out in the sun for too long and don't use sunscreen, sunblock, and they get really bad sunburns, and so hopefully you don't do that.
I like basically like put a bunch of sunscreen
That's
on
good.
myself.
Good to hear. Good to hear.
Yeah.
And the last most common type of carcinoma cancer is renal cell carcinoma cancer, which is the one you have. It is, like I said, a common kidney cancer. It usually starts off as a single tumor and grows within your kidney, and it can spread. Luckily for you, it didn't. And it is genetic, and you got it genetically, right?
Yeah, my mom had it, my grandparents had it, so
totally.
I expected
it. That's good. It wasn't out of the blue.
Yeah, pretty much.
Okay, so you will be starting your chemotherapy radiation after your surgery. So until your surgery, which is in a couple weeks, you need to be aware of blood in your urine, pain in your side that doesn't go away, any large or larger lumps in your abdomen area, loss of appetite or no hunger, weight loss for an unknown reason, and if you see any of those symptoms occurring in the next couple of days or couple of weeks, you need to call us immediately because this is a sign that the tumor in your kidney is spreading or growing.
So then we would have to do the surgery faster than
Yes, and it's worse if it spreads too. So Nurse Jenkins will, when you leave after we're done, she's gonna give you a pamphlet and just everything that I just told you about the symptoms and everything. It's gonna all be on that pamphlet. So read through it, make sure you know what's gonna happen if anything bad does happen, so you know you don't freak out or anything, and it'll all be okay in the end. And just make sure you stay healthy, get exercise, and you don't smoke any tobacco, right?
Mm-mm.
Okay, that is another way you can get renal cell carcinoma cancer. Smoking tobacco use.
You have to smoke like regularly, right?
Yeah, and misusing pain medications, and it can be over-the-counter medications.
Like Advil or something.
Like Advil, you don't overuse those, do you?
No.
Do it for your pleasure or anything?
No.
Okay, that's good. That's good. All good things to hear. And that is about it. And if you have any more questions, feel free to ask me, call me, email me, anything. I'll be here.
All right.
So, good luck. Everything will be okay. No need to worry. So, your family members, everyone, tell them to calm down.
All right. That's
Everyone's
good.
going to be okay. So, all right.
Thank you.
Bye.